So what happened is, we all understand that healthcare is a good, it's a good employment generator. I would say it's a very labor intensive area, because so many segments of people and skilled workers, not necessarily only medical professionals, but so many skilled workers are required to render services on a particular patient, whether it is in acute care or whether it is in subacute care. So that way I think we will also be an employment generator with this type of units. And then we are trying to see how we can actually put up these units at 20% of the cost of the hospital bed. And here we don't intend to treat patients or intervene in as an acute care management. We only are complementary to hospital to provide that supportive services in a post-hospitalization phase. So I think this is what we are trying to do, and we will come out with more and more information as since there are not many players in this area, no data has come out about this particular segment, and this is a very essential component to determine the outcomes of patients who undergo acute care management in an emergency situations in the hospitals. Now through this media I would like to actually appeal to the IRDA and the insurance companies to look at this particular space and extend their support, not necessarily only to hospitals, but to certain period in the post-hospitalization phase. I understand the deliberations are going on. We would be very happy if that can be expedited. Now coming back to the clinical profession, what we have been doing. Now I think going forward in hospitals, I think individual practice is going to be very difficult. Now we have seen actually the concept of general practice, which used to be there in say in 1960s, 70s or even 80s, have slowly transformed and become actually more specialty oriented practice, and then specialty to now micro specializations, and then it is getting into that. There are good and bad things about it. The good things is that we could actually increase or improve our understanding and to a greater detail about certain disease conditions which probably we were giving up in the past, not able to render the therapeutic modalities. That is the good thing of it. So now people are becoming increasingly confident and expectations are increasing towards the medical profession to render any type of service where for everything that they believe now there is a cure. While that is the thing that is the message that is going out, the disadvantageous aspect of it is the holistic view of a patient, which probably used to be with a family physician or the GP in the past, has actually taken a backseat. Now I think that requires and then the disease burden itself on the society have shifted from the earlier 4 decades back on infection based and nutrition based issues to lifestyle related disorders. There is some genetic background for that, and also the change in lifestyles that has happened after the economy started looking up. I think that makes it very imperative for us now to think about investing into primary, preventive and promotive health care, and then prevent people from migrating into a disease spectrum rather than treating it. I think that focus has to change a bit towards that. But having said that, already heavy investment has gone to tertiary level centers, and I think that has to continue. On a population basis, still we are nowhere. I would say Indian healthcare even has not started. I would say that because quite a good significant amount of people still do not have access to a decent healthcare facility in this country. While that efforts are going on, and as efforts from the government to increase the number of churning out more medical professionals from the institutes, and then the number of institutes also being increasing. I think hopefully still it takes, I think my estimate about it will take another 2 decades to somehow think that we have a reasonable access of medical care to most of the population in the country. Now having said that, the other thing in the profession is that because of this micro specialization, I think while certain things are possible to change, there are a lot of changes that are happening in the concept of understanding the practice or delivery of medical care to the people. Previously, people used to believe whatever medical professionals are actually are advising them, and that is always a top-down approach was there. They used to actually believe and understand that the ultimate thing is whatever is coming out in the in terms of advice or service from medical professional is taken for granted. But then now with enormous amount of knowledge dissemination that is happening through various media, whether it is because of the internet basically, and a lot of information because of the dissemination of the information that is there, I think most of the people know about their health condition and medical condition. So there's a rapid paradigm change that is happening in the delivery of medical practice itself. That is, now instead of the top-down approach from medical professionals to consumer of services, the consumer demand delivery of service is happening. That change is already noticed, and that is going to be the right aspect because the consumer already knows the choice for a particular disease conditions. If he has an alternatives of 1, 2, 3, 4, he would come out and say demand this. He chooses certain modality of management of his disease condition, and that is what probably medical profession as a profession has to render it. I think the choice of making a decision how he wished to be treated would rest with the consumer, and then that focus will change on the medical profession, that they are supposed to only render their expertise in delivering that particular service. That is one thing what we are witnessing now. And the other aspect what is happening is there is a lot of genetic basis that is evolving in the last I would say 15 years or so, since the information that has come out from Human Genome Project. That information, though it started in 90s, the Human Genome Project, I think by 2005 or 6 the information started coming out, and that data, based on that, a lot of work is going on, and now we understand for every disease condition there's a genetic basis, and the management of the disease condition is going to happen at that level, whether you call it gene therapy, whether you call it as whatever it is, to prevent or treat certain things that is happening. Then what we noticed in society is, in general, the societies or the population is aging quite a lot. Their average life expectancy is increasing. Most of it is happening in the eastern part of the world, and then Europe already, you know that they are already very aged population, and this is going to be another burden, and I think that aspect of it is looked at too. One of the important subject what is going to be holding a significant, I would say, a significance or importance going forward is one subject, that is aging, and how do you deal with it. There are a lot of, that is, in general, we may call it as a geriatric medicine, but then there are a lot of research work that is going to go into it, and how do you keep the population of people healthy and then productive, up and mobile with aging. I think, and then reduce that unproductive years to very short length of time. I think that amount that is enormously being looked into, and unfortunately in India we don't have that type of what do you call that wherewithals or the resources to go into that type of research. What actually, so most of it still we are relying on Western data, but I would say it's still improving in India. But then we have a lot of length to travel. But I think India also, we know that we are about 170 million people are there who are above 65 years, and then that is going to go to almost about 300 million in another 2 decades. I think there also medical profession has a great deal to contribute and see how we reduce the burden of treating these people or taking care of these people with the social economic conditions precluding from taking care of these elders at a family level, or I would say because of the feasibility of factors that how the elders can be taken care because of certain challenges. I think we have to think loudly how this particular population can be looked into, and then see whether we can render some, we can think over something to see how do you keep them productive, and because of their experience, and then they will be a great contributors to the nation. That is one thing we have to look into. I think that these aspects in medicine will take quite a lot of I would say thought process, attention and research. That is what our understanding, and that is why we thought, why only stick to your own specialty practice, which anyway we are doing, and we are trying to do something good in that particular thing, getting institutional practice into all the wherever we are trying to do the service, but also thinking on the other aspect in trying to understand and change with the change in the ecosystem of medicine, and how the leadership and thought process of medicine at a global level are thinking, and with the digitalization that is happening, with major corporations coming into it and try to digitize medicine, whether it is IBM, whether it is Scripps Foundation, or whether it any other institute, and then the translational research work that is going on, with the combination of both medical profession and the major non-medical corporations or business houses, especially in the West. I think we are trying to keep a track of what is happening across in these places to render ourselves more meaningful in delivery of medical service, and then do our bit of as a contribution to medical practice in this town. This is what I would like to say today, and then going forward we'll hope to have more interactions, and I'll try to narrate whatever our learnings are, and whether it makes any sense to people or not. I think this is what I would say from my side.